blood underneath the skin. You don't want to draw from a hematoma because the blood you may get is not the blood that we want. It has already clotted and it's just accumulated underneath the skin, not actually from the vein. And so you always want to draw below a hematoma if you have one. Edema, you can have excess tissue fluid. We want to be careful if somebody comes in really swollen. Obviously, that's going to alter the angle of our needle, the depth of our needle, and we don't want to access excess fluid. We want to get the blood from the vein. Burns, scars, and tattoos, they're prone to infection. So when we draw from those areas, we may risk an infection as well as there's reduced circulation. Mastectomy patients, typically they let you know when they've had a mastectomy and they know that they cannot have their blood drawn from the side of the mastectomy. So you always want to go with the opposite side. It's because the removal of lymph nodes and it can interfere with the lymph fluid, and so it can alter test results. And so it's important. Again, patients should let you know if they've had a mastectomy. They typically tell you that they've had it on this side and they know to have their blood drawn on the other side. Obesity, that can make a blood draw more difficult. Obviously, you need to go in deeper. Often the cephalic vein is more prominent because it's more of a surface vein. And so vein selection is very important if you have an obese patient. Also, the size of your needle. Sometimes you may need to use a syringe instead of vacutainer system, and you may need to do a straight stick, not a butterfly. And so palpating the vein and using your knowledge as far as, how much tissue is in between the vein and the skin will help you get a successful draw. If somebody's going through IV therapy, if they're going through infusions, or if they are an IV drug user, we want to try and stay away from that vein that has been poked a lot. That way we can lower the risk of injury and have accurate test results. Typically they will let you know, but if you are having trouble selecting a vein and they don't let you know, and then you have the right to ask them, okay, has this vein been poked a lot? Is there, and they may be able to give you advice and be honest with you. Cleansing the site, very, very important. Sometimes you use alcohol. Most of the time you do for standard tests. Other times you use a stronger antiseptic. You can use iodine or hexidine. You can use the zephyrin chloride. And so these antiseptics are used for tests that require a higher percentage of as far as risking antimicrobials or infection. And blood alcohol test, again, is another one. You don't want to cleanse with alcohol when they're doing a blood alcohol test, because that can alter the test results. As far as venipuncture using a syringe, we'll show you this in class, but it's a different technique that is used sometimes for veins that collapse or for obese patients, certain situations where you don't want to use that vacutainer. Here on slide 22 is a picture of using a syringe. That's where you pull back on the syringe with the needle and suck the blood out that way instead of it being sucked into a tube. Here's some more pictures here, just demonstrating syringe draws. Venipuncture using a winged blood collection set, a butterfly needle. The needle is smaller. It's a smaller gauge. You go in at a different angle, 10 to 15 degrees. It's ideal for small and fragile veins. You can actually, once you insert the needle, you can let go of it because it's secured with the wings onto the skin to where you will stay in the vein, so you no longer need to hold on to it. You will see the blood in the tube if you got the vein, and so you can see the flash, and that is security knowing, okay, I'm in the vein. It's important to use a discard tube when collecting anticoagulated specimens. The reason for that, if you're doing a PT-INR, prothrombin test for somebody for anticoagulation studies, it's important to use a discard tube because the first tube you pop on may have already clotted slightly because of the vacuum system, where if you're in the vein and you've already drawn one tube and then you pop the next tube on, that blood is fresh and hasn't coagulated yet. So if you're just drawing for a coagulation study, you'll use a discard tube ahead of time, which is just a tube to collect the initial blood, and then you pop on the tube that you need for the test. We'll demonstrate this in class as well. As far as using a butterfly needle, you always hold by the wings, not by the tubing. And so very important with your hand placement. You don't want to poke yourself with the tubing. The needle can move around, and so it's always important to hold it by the wings at all times. That way you don't stick yourself or the patient unnecessarily. Here's some pictures of a butterfly needle doing a hand draw. Technical complications, you can have a failure to obtain blood. It might be your needle position. You may be in too deep. You may be too much on the surface. The bevel against the vein can cause resistance, and so you want to make sure the bevel is within the vein, not just on the top. And so bevel always is up, and make sure your angle is correct, because it may not be that you misguided it. It may just be that you shot through the vein, went too deep, or may not be deep enough. So bevel up and always make sure to have the correct angle. That way there's less risk for those complications. I'll show you in class, a big part of missing the vein is movement. And so if your hand is not stable, you may move as you grab a tube. You may not be in the vein deep enough. It may be too shallow. And so it's very important to use your hand as an anchor. That way you're not moving the needle around, and you can rely on your hand, your firm hand against the patient's skin for no complications for movement. Collapsed veins, you may get into a vein and you're there, but it collapsed on you. Maybe that the vacutainer was too strong, so it sucked a little too fast, or the syringe, if you're drawing from a syringe, you may have pulled back too fast. So very important, if you feel like you're in a vein and it collapses, it may just be that you need to release the tourniquet, allow more blood flow, or maybe the wrong type of needle that you used, or it may be the vacutainer or syringe. As far as the tourniquet, it's very important to not have it too tight or too close to the site. That can cause a vein to collapse. Also, when you are using a syringe, very important not to pull back too fast. That can cause a vein to collapse. Anchoring is very important. Again, you don't want to move around, and so you want that needle in the vein and your hand to be very stable. That way there's no risk for movement and losing the vein. So anchoring, very important. Veins can roll, they can move, and so it's very important to anchor down and make sure that that vein is nice and stable. Always be careful of the brachial artery and nerves. Again, this is where proper placement and vein selection is very important. Sometimes the tube vacutainer system can be an issue where maybe it lost its suction, and so that happens. Again, having extra tubes within reach is very important. That way, if you feel you're in the vein or the flow stops, you have another tube you can pop on to see if that will add wrong type of needle that you used, or it may be the vacutainer or syringe. As far as the tourniquet, it's very important to not have it too tight or too close to the site. That can cause a vein to collapse. Also, when you are using a syringe, very important not to pull back too fast. That can cause a vein to collapse. Anchoring is very important. Again, you don't want to move around, and so you want that needle in the vein and your hand to be very stable. That way there's no risk for movement and losing the vein. So anchoring, very important. Veins can roll, they can move, and so it's very important to anchor down and make sure.
Okay. We would have gotten this totally fine, but we didn't because we are here.